So I've had a ton of requests to get you on, and I'm very excited. This has been a very interesting scenario as things have played out because as things change so quickly, what is good information seems to be bad information the next day, and then goes right back, and it seems to flip flop around, and finding sources and that kind of thing is the toughest,
Yep.
and so I'm very excited to have you back.
Well, there is no other way I'd rather spend a late Friday afternoon and early evening than here. No, really, I I knew we would need to talk again. Part of it is I do know that things change, um, and I think it's probably time for us to at least talk so we can get at least a series of questions answered, and then sort of see where this goes on from here. But I imagine this won't be our last time, but we'll go from there.
Yeah. So I guess from our last podcast that we did, is there anything in particular that maybe we had spoke about that was uh, that has changed since then? I mean, on maybe instruction or things like
Yeah,
that.
so, good point. We I think the biggest guidance for the general public that's changed is the guidance regarding masking in public.
Mm-hmm.
Now, I know that was a question early on: should the general public wear a mask or not? Initially, the guidance was we don't recommend for you to wear a mask. Partly because for many people, when you wear a mask, you're going to be touching your eyes and maybe your mouth and fidgeting with your mask, and then you could transmit the virus to yourself.
Mm-hmm.
That's still a risk, although we know that masks will do a couple of things. One, they'll help to prevent virus that you may be shedding out of your nose and mouth from contaminating the area around you.
Mm-hmm.
And it may help to protect you from less likely, but possibly getting from viral particles from other patients or other individuals in the public onto you. So there is an option for masking for the general public. I would say that it's going to be more important in certain areas than in others. And so um, I uh, I am not currently wearing a mask when I go out in public.
Mm-hmm.
But if you do happen to see someone with a mask on, it doesn't mean that they're crazy or a germaphobe or doing something that's completely without guidance. The CDC has changed their guidance just as of a few days ago to say it's reasonable to wear a mask. There is guidance on exactly how to make your mask at home. Um, Again, part of our initial thought was to say no masking because you could contaminate yourself because you're touching things with your hands and then fidgeting with your mask. And we wanted to preserve some of the medical masks, though they're the N95s or surgical masks or procedure masks that are medical grade masks
Mm-hmm.
that wanted to be preserved to protect healthcare workers. And so I would say that that guidance still stands. So it'd be best for the general public to try to make your own mask. They actually have some guidelines and guidance on the CDC. I think it's probably the first time I've ever seen sewing patterns on the CDC,
Yeah.
but they're there.
My mom's been doing that, making
Mm-hmm.
people masks,
Yep.
and I know a few others that have been, like Lexi Haddock, and
Yep.
yeah, and her mom as well.
So if you're going to make masks, try to adhere to those guidelines. There's really simple ones with just a t-shirt. There's another one with a bandana and a coffee filter, and then there's another one with, actually a sewing pattern. Your masks should be washable, and you should be, cautious with, demasking, meaning if you're taking your mask off, don't put your hands all over the front of it and then touch your eyes, right?
Mm-hmm.
That would be problematic. And if you're taking your mask off, you should fold it inward so that the outside of your mask is sort of folded down, and then put it in a paper bag, and then you can use it again so long as you're careful. And you should wash your hands before and after touching your mask.
That makes sense. That makes sense. So, uh, another thing too that I've seen people doing. So like everyone's kind of been making these masks, but uh, it seemed like that there was like a particular thing that they're supposed to be in there. So if you are into like making masks, it's not just like a folded up piece of cloth, correct?
So there is some guidance that it should be multiple layers
Okay,
of
maybe that's what it
cloth,
was.
right? And my feeling is that I think that's as specific as I'm going to go on this podcast, but cdc.gov, or if you Google search for CDC and mask guidance, it'll take you right there and you can get some more guidance on how to make that. And if you're making those masks for yourself or your family, and wanted to potentially distribute them, you are welcome to bring some to the health department. And then if you're really interested in getting a mask, you can contact the health department and ask if we have some for you.
Yeah. How are supplies down there for you guys? I mean, are you doing all right? Or?
Well, and again, there's a difference between public health and clinical health. So most of what we do in public health, so I practice both public health and clinical medicine, but in public health, we don't need a lot of PPE or personal protective equipment because we're not having a lot of face-to-face interaction with patients.
Mm-hmm.
However, the way things are set up now, the local health department is in charge of trying to secure and order and deliver PPE or personal protective equipment, which includes masks, gloves, gowns, eye shields for everybody, all the clinical providers in the Bi-County area. And so it's strained.
Yeah.
I would just say that there's this idea that early on or a month ago that there's this concept of, not a concept, it's a thing. It's called the SNS, or the Strategic National Stockpile, right?
Okay.
They have a stockpile of lots of things.
Okay.
They
Yeah.
have,
Actually, I heard that.
yeah,
Okay.
they have a stockpile of ventilators. They have a stockpile of PPE. They have probably stockpiles of I don't know what, right?
Mm-hmm.
But from what I've heard, that stockpile is, in terms of PPE, is fairly low. You could use the word depleted, and there has not been a big distribution from the national stockpile into the hands of the Fountain and Warren County Health Department.
Yeah, I'd watched kind of like a briefing with the mayor, or no, the governor, I'm sorry, of New York, and they were mentioning about how many ventilators they needed. Right now, I know it's like a disaster
Right.
in New York, and it seemed to be very difficult for even for them to get them. And they're, I guess when they had got word that they were going to get like 400, they're like, well, what do we need like 40,000. What are we going to do with 400?
Right.
Yeah. So I'm sure that Attica and well, Fountain and Warren County, I'm sure it's got to be very difficult to.
Right.
I mean,
And I would say, for those of you making masks, if you're making high quality masks and want to drop those off at the health department, there may be a point in time where medical workers would use those. Right now, we're trying to make sure that they have medical grade, manufactured quality masks, but that, depending on what happens over time in mask production, that we may need to use other resources. So, and I know that some in the community, I know we've been working with some seamstresses. If you've gotten some mixed messages, I think it was probably because we were hoping we would, get more distribution from the national stockpile, but we haven't. And so, if you're thinking and saying, oh, well, now they could use masks. Yeah, if you want to make a couple hundred masks and you can make them, high quality, then drop them by, and we would take a look at those and potentially distribute them, maybe to the public, maybe to EMS or nursing crew or otherwise.
yeah. So by the sounds of it, it doesn't sound to me like you're very confident this is going to end anytime soon for us.
Right.
So I guess with that, what do you see coming up in maybe the near to even not so near future? Do you see this playing out over still a few months out? I mean, it doesn't. I highly doubt we have hit our peak yet in the
Right.
community, but
So it's the answer is complicated, and as with many things in life, and there is this verbiage that I've heard a lot, and I've even used it, and it's accurate to say that it's so many days until the peak, or and until the surge, and this is a true statement, but it's leaving off the last half of this. This is so many days until the peak of the first wave of the virus, right? So the first wave of the virus is near peaking now,
okay.
on a national level, right? And that's peaking in terms of number of deaths. And I actually, one model that and we say models, these are models that use lots of statistics to push out different curves and say, well, what do we expect of this disease? Many of the models say that the peak in the United States in terms of death rates is around today. I know that there are some county level modeling that suggests that the peak in Fountain Warren County is probably going to be about 2 weeks out. That doesn't mean, I don't want people to say, oh my gosh, we're going to, have lots more deaths in the next 2 weeks than we have already. I would say we probably will see some, but this is the peak or the surge of the first wave of the disease. And the reason, one of the questions I know people have is, have we been successful at flattening that curve or slowing that spread?
Yeah, that was a question that I had for you as
The
well.
answer is that yes, we have. And I think we have been successful in Fountain and Warren County and in the state of Indiana. We've been successful across the country. That's not to say that we couldn't have done better, but we would have had to start our efforts earlier if we were going to do better, and we didn't. So once we started our efforts, that yes, this social distancing, and I am going to draw a distinction because I think that the term social distancing carries less weight than what Governor Holcomb has done and many governors have done, which is stay at home,
Yeah.
or shelter in place. That statement and social distancing, they just seem to be different things.
Definitely.
Yes, and I think that our federal government is very much said just kept this word. It says social distancing, and now they've come around to say, well, that's the same thing as stay at home. If it's the same thing as stay at home, then they should just say it,
Right.
right?
Yeah.
So my feeling is, yes, we've been successful at flattening the curve, and that has been more helpful in Fountain and Warren County than other places. It has been helpful in the state of Indiana. It has been helpful in New York City, but it depends on when your efforts were put in place. And I think that once your efforts are put in place, there's this domino effect that you can't stop everything that's moving down the pipeline. And so there is this surge that's happening now. You may not feel it here, although it's a mini surge because partly because we've taken good efforts, partly because the public has responded, I think, reasonably well in terms of adhering to guidance from the Fountain Warren County Health Department and guidance from Governor Holcomb. And in other places of the country, they've been less successful, partly because their populations are more dense, and then partly because the disease was further spread at the time that they instituted the social distancing or stay-at-home measures, if they ever instituted them. I'm not quite getting into how long this is going to last, but this is the peak or the surge of the first wave. The peak in Fountain and Warren counties probably predicted to be about 2 weeks out, and that means that it took us 6 to 8 weeks to get to that peak. the 6 to 8 weeks after that would be the downhill of that peak. And then what happens from there depends on lots of things that I don't know.
Okay. So that makes sense. So do you, I guess, do you see that? See, I mean, well, I guess you're just straight up saying it. Then you're gonna see it play out for another. You're saying 6 to 8 weeks yet, total.
At a minimum.
Yeah.
So let me say that then the big question is that, well, what happens with these stay-at-home orders that are currently from in the state of Indiana are set to expire on the 20th at midnight? And what is the availability of testing? What is our ability to do effective contact tracing? That means if you identify someone who has COVID-19, how successfully can we trace the contacts that that person has had, isolate or quarantine that individual so that they don't infect others, and then identify those contacts so we limit them from infecting others that they may not know that they're sick.
Right.
And then if we're good at testing, contact isolation, and adhering to the rules of social distancing, then we can limit future peaks in the future, or future peaks in this disease. But even after we get through this first peak of disease, the estimates are that only 3% of Americans are going to have been infected. And that means 97% of people have not been infected or exposed. I don't know that everybody likes these models or these peaks or these numbers, but that means that 97% of people are still going to be prone or susceptible to getting it. And is that going to happen? And if we let down our guard, then we will see a bigger peak, a bigger wave. If we maintain our current status quo, well, we'll never see a peak, but then we will never get back to normal.
Right.
Right? So we can't all stay at home forever. That is the really, really tricky decision that the elected leaders, mainly on a state-by-state basis and somewhat on the federal government, are going to have to make, is to say, well, what can we do? I would say that I mentioned contact tracing, I mentioned testing, and based on what I am aware of, I don't know that we still have enough or high quality enough testing to let the stay-at-home orders expire on midnight of April 20th.
Yeah, so that was one thing I was curious about, is how accurate the tests are. Mm-hmm. Because as I've done the little bit of research that I have, and it's tough to find, accurate information, but it seemed like that there was certain things that would maybe trigger like a false positive as far as like having COVID-19. And it seems like maybe the testing is a little bit more readily available, except the last statistic that I read is we had only I think we've only tested, as far as the entire population across the United States, was somewhere around like 0.6% was what I read. I don't know how.
Oh yeah, so that's about right. So we've done about 2 million tests in the United States, and you're right. I think that we have 340 or 370 million, something like that. So that's probably statistically about right. So we've tested very few people. And the number of people that you need to test to contain the disease depends on what stage of the disease that you're at. So if you're very early on in the disease process, like South Korea, they ramped up their testing very aggressively, very early, and they did aggressive contact tracing and isolation and protecting the vulnerable people. And they tested 500,000 people super early, and now they're still doing some testing, but they don't have to do that much anymore because they were able to isolate the infected individuals. Now, the United States was a lot slower at getting testing up and running, and the disease took a better foothold here, and then it's going to take more testing, not just because our population's bigger, but it's going to take a disproportionately larger amount of testing in the United States to sort of really figure out how far this disease has spread, and then have tighter restrictions in certain communities or localities and looser restrictions in other communities.
Yeah, so it sounds to me like the big thing is testing and getting the information out, and then taking care of the folks that do have it. And
Correct.
try, yeah, okay.
Yep. And protecting those that are vulnerable, and everybody else. Hopefully, if we can ramp up testing, if we can do contact isolation or contact tracing, and we can do appropriate quarantine measures for those that we think are exposed or infected, then it may allow the rest of us to have some sort of normal life. But the time frame on this is still long. It's 12 to 18 months until maybe a vaccination is available.
Yeah.
And then if that vaccine's available, then it doesn't necessarily mean it's going to work really well. So after we get through this first surge, say 6-8 more weeks, then 3% of the population is going to be infected, 97% still susceptible. What percentage do we think of Americans are going to be infected or need to be infected until we have some sort of herd immunity? That means there's enough infected people around you that
Yeah.
you're not going to spread it to someone else, and they're going to spread it to someone else. And that means we need to get somewhere between 60 and 80% of Americans infected in order to have a herd immunity, or we need to have effective treatment, or we need to have, some or an effective vaccination. Those are the options.
Yeah, and like, so kind of moving on to what you would do, if you have it. Some of the things that I know are being talked about are hydroxychloroquine,
Right, right.
vitamin C, vitamin D, zinc, and it sounded like vitamin C and vitamin D were in like super high dosages. Is anything like that? Does that all? I mean, from a medicine standpoint, is
So,
that?
let's talk about vitamins. Vitamins are critical for life and your
Yeah.
health, and I recommend that you get your vitamins through your food. That's going to be better for you, healthier for you. Um, I I generally don't recommend taking a multivitamin unless you're an alcoholic or you're really old and you live on your own and you can't get to the grocery store, and and you hardly eat anything, and or I had this one patient that weren't from here. This was a long time ago, who ate nothing but Suzy Q's and had a significant vitamin deficiency because of it. So there, I would say eat your vitamins. Don't take them in a pill form. There is no evidence for super high doses of vitamin C, D, or zinc to be curative for COVID-19. There is no current treatment guidelines that would encourage doctors at the hospital to be doing that on a standard of care basis. That doesn't mean they couldn't do it. It doesn't mean that, it just means it's not going to be the guidelines. Now, hydroxychloroquine and chloroquine
Or chloroquine. That's
are more complicated, and they are more complicated. Although I have sent out several emails to all the clinical providers. That means anybody who's going to be prescribing medications in Fountain and Warren County. And I think this is important for all the patients here too, is that if you're looking at hydroxychloroquine or chloroquine as some saving grace for COVID-19, you're looking in the wrong direction. And if you are hearing it from your leaders that this is the right answer for you or your family, then they're blowing smoke. Okay, this is a dangerous and misleading pattern of thought that's out there. Now, Hydroxychloroquine in particular is worthwhile to investigate more closely.
Mm-hmm.
However, the initial rush towards the thoughts of this medication are based on two different studies. One was out of France and the other one was out of China. The one that was out of France, when I read the paper and sort of read some analysis of the paper and spent a little bit more time looking at it, it should never have been published in the first place. And I think there's a lot of people who felt that way. And by that matter, the scientific journal that did publish it just recently has retracted it and said, we shouldn't have published this in the first place because the science was bad. Now, do people make mistakes? Yes, people make mistakes. It's a scary time, and they published it. The same thing happened with the Lancet in publishing, vaccines that cause autism. And I don't want to offend, anybody out there who's going to turn this off now because I don't think vaccines cause autism. But the Lancet withdrew that article, shortly after they published it. So once it's out there, if it's then people just look at the findings, and you have a lot of doctors, scientists who just read the abstracts, which means just the results, and they don't look how they got to the results. And if you want more information about that French article and why it was so poorly designed, I would just say that they eliminated from the treatment group, meaning the people who got hydroxychloroquine, they eliminated from the analysis of the results the people who got hydroxychloroquine who died or transferred to the ICU. They said, okay, well, you're no longer in this group, so we're not going to analyze you as part of the results. Well, that doesn't make sense. And then that was only just the tip of the iceberg in terms of the faults of this scientific study. And it was only 40 patients in the south of...
Oh, I didn't know that either.
Yeah, it wasn't that many patients. And so hydroxychloroquine as well, it is potentially toxic. It has, significant cardiac risks, especially for patients who are already very sick. I think it is interesting for us to investigate this more. There is some in vitro activity of a hydroxychloroquine against certain viruses. That means in a test tube, it's been shown to kill certain viruses. Although I think there were some initial in vitro studies for influenza which showed that hydroxychloroquine was promising. But once we actually studied it in vivo, meaning in living people, it wasn't effective. So we don't use it. And so for us to jump the gun and potentially use a medication that has toxic effects and is potentially dangerous, and furthermore, there are people who use hydroxychloroquine for medical conditions that they need, like lupus.
Yeah, and there's a shortage now, right?
Yes, that really helps their health and their well-being. And now some of them can't get it. It's a hot mess out there, and I think the blame needs to be laid somewhere. And I would say that we need to make sure that we don't get confused. No one likes to be experimented on, and I would say that if I was going to use hydroxychloroquine for treatment of COVID-19, I would be very cautious about using it. And that's for treatment. And my feeling is that I've encouraged any provider that I work with that if they're considering using hydroxychloroquine, they should come and discuss the case with me first.
Makes sense. Yeah. So I guess on to something that sounds maybe a little more promising, but sounds like it's still kind of in the beginning stages, is if you have had it and maybe you were asymptomatic, or you beat it and now you're kind of on the better side of things. donating plasma.
Hmm.
Is that something that sounds like it's working? Isn't working? You know, it's just things that they're trying right now that we're reading about.
Yeah. So I don't know the success rates of that plasma from convalescent donors. Convalescent means that you've had it and you've recovered from it, and your body's created antibodies to COVID-19, and then they take the plasma from you, those antibodies, and they give them to people who need them. The logic of it makes sense.
Uh-huh.
There's certainly some risk. It's time intensive in terms of you've got to identify the person who had it. They have to donate their plasma. It has to be processed, and then have to decide how and when to use it. But there is that going on, and so for the few people around here who've been infected with COVID-19, if you recover and you're interested in potentially donating your plasma, then I know that the Red Cross is helping to streamline those procedures. So my feeling is yes, I think that has some potential benefit in terms of exactly how it would be used and for which cases. It's probably going to be for more severe cases, and then I think that has some promise.
That sounds good then. And I know right now what seems to be kind of on the forefront of everybody's mind is, you know, how what is more threatening to society? Is it COVID-19 or an economic collapse?
Right.
And I was just curious as to what your input is on that. You know, I mean, if you leave everything shut down and people can't go to work, and you know, to try to beat this illness, is that the priority? Would you say, or would you be more likely to tell people to go
Mm-hmm.
back to work and try to stick this thing out? Where do you stand on that?
So I think that I think to me the right answer is a balance.
Yeah.
Um, I think that these drastic actions that we've had to take over the last about month um, are necessary and were important for a few things. One, to prevent our medical system from getting overwhelmed, and two, to protect the most vulnerable. So we've been successful at that.
That's good.
Now, um, we've been successful mainly here in Indiana, less successful in other parts of the country. Although, again, I think that this first peak, the surge of this first peak, this first wave is on the downhill trend. So I think it will improve, and then um, I do think we need to find a way to get back to normal, or more normal, with more people going to work. Now, what that means is that as we do that, there is going to be more people that get the disease
Mm-hmm.
and more people that die. It doesn't mean they're all going to come at once, um, but in order to get back to normal, then we all have to follow the rules, still practice social distancing, still try to protect those that are most vulnerable, so over age 60, comorbidities like heart disease, hypertension, diabetes, etc., smokers, COPD. And then when we feel sick or start to feel sick, we need to err on the safe side and stay home. We need to keep washing our hands, not touching our face, and things like this. So my hope is that we can get back to some sort of normal, but I think it's going to take everybody to play together and work as a community, and try to help out those people who maybe it's going to be harder for them to get back to normal, meaning the people who really should stay isolated. And then that means if the health department calls you about contact tracing, then you help us out,
Mm-hmm.
right? You say, you know, don't be rude, answer questions, realize that we're not being nosy in your life because it's what we want to do. We're being nosy in your life because it's best for the community. And I think probably the best piece of advice that I would give everybody moving forward is it's not about you.
Yep.
And even this morning, I had to tell that to myself because I got up. I wanted to go grocery shopping early, right? And so I love Meijer. I was going to go to Meijer, but then they didn't open till 8 and it was going to be 9. And I'm like, well, screw it. I'm not going to, go there then because then everybody's going to want to go at 9.
Yeah.
And so I was like, okay, I'm going to go to County Market. So I checked before I left home. It was about 6 a.m. And I'm like, okay, I'm going to check their website and see, are they open? Are they still open 24 hours or not? And it said they were. And I'm like, I wonder if they have special hours for someone, right? Because I know that that's going on. But then I didn't find it. I don't know if I didn't look in the right place. And I'm like, okay, great. So I'm going to County Market at like 6 in the morning. And I drive up there and then I like get to the door and I see all the signs and it says, we've reserved the hours of 6 to 8 a.m. for, our most vulnerable population, if you're over age 65 or something. And I was like, ugh.
Yeah.
So I'm like, well, maybe I should just go in. And then I walked up. No. I walked up to the door and I saw the health department sign and I'm like, ugh. Okay.
It was like your face right on there.
It's not about you. It's not about you. So go home, right? So I went home. I drove by the food basket in Williamsport. It wasn't open. So I'm like, okay, we don't need anything that badly. I'm just going to go some other day. So,
yeah.
But it's hard. I get it. This is not exactly how I want to be living either, but it's not about me. And it's not about you. It's not about any one of us as individuals. It's about how we get through this successfully. And yes, I believe that we need to try to get people back to work. Exactly how and when that's going to happen depends on strong leadership from above, and that means the state and the federal level. That means allowing appropriate testing. And if we don't do it right, it's going to be a mess. If we don't do it right, it's going to devastate our economy worse than just than doing it right. And so these steps were necessary, but I'll be honest. If we would have acted as a country more appropriately earlier, and there's statements to say, oh, we did everything right. If you think we did everything right, just look at Germany or Singapore or South Korea, right? Mm-hmm. They've done things right? They've got the numbers to show it. United States, and I'm not proud of this. We shouldn't be proud of this, but yeah, we've done the most testing now, but even before we'd done the most testing, we still had the most people infected. It's not because we're the biggest country. I mean, China's got 1 billion people. Right? And they've done lots of testing there. And we've got, probably today is the day that, unfortunately, and I'm not saying this because I'm proud of it or because it's something to prove my point, but I'm saying it because we need to learn from it. That probably today is the day that the United States is surpassing Italy and leading the world in deaths for COVID-19, right? So we have more deaths from COVID-19 than any other country in the world. And that's unfortunate when we are one of the latest countries to get infected with it, right? I mean, we could see this happening in China, Japan, South Korea, Singapore, Italy. and we did not respond appropriately. The steps we've taken now have had to be pretty drastic, but they're not as drastic still as many countries have taken.
Yeah.
And so everybody who's chomping at the bit to get back to normal, I would say, well, I would say hold your horses, be patient. It's not about you. And if we try to get back to normal too quickly, it will cause more destruction and devastation for you and your family and your community and your neighbors and your company than being patient.
Yeah. And all that definitely makes sense. And I mean, it sounds like right now New York, I believe, actually just surpassed Italy as far as per. I think the statistic I read is it was like deaths per day. I think they just
Right.
surpassed them on that.
So I think New York has. Yeah, I think that's a true statement. And New York, well, I don't know exactly how true that is, but I would say I wouldn't be surprised.
Uh-huh.
But we're at different points in the curve. New York's had, I think, around probably close to 7,000 deaths total, and Italy has had around 18,000 deaths. So,
Yeah. Um, Now, one thing that folks have been asking about is, do you think that this could have been in the United States earlier than what they had expected or what was released as far as dates? And with that question, do you think that more people might be asymptomatic of this and maybe it isn't such an issue to as many people as were expected?
yeah, so I know that there's some questions about that, particularly on the West Coast,
Mm-hmm.
in California, because they have a little bit more uh, East Asian population than probably the rest of the country. And then there's some thought, oh, was there a spike in COVID-19 like illnesses in the Bay Area back in November? And I would say that I don't know that. They are doing some testing and investigation to, I think, try to clarify that further. Um, and so, yeah, that just like some other things that we don't know, including, how this virus will act in the summertime, or, you know, how much does being infected with COVID-19 prevent you from getting reinfected with COVID-19,
Right.
right? And so I think that's worthy of investigating. Right now, I, 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 I don't have any insight to say that that is true, or not true. Uh, but I think, well, it'd be sort of great if it was, um, if it had been here earlier, because then more people would potentially have been exposed and be immune.
Yeah.
Although, when we look and we see how devastating it was when it was in Wuhan, China, and how devastating it was when it was in um, uh, throughout Italy, and how devastating it is in New York City and other Detroit and other places around the country, it seems unlikely to me that there would be um, a lot of asymptomatic, or a lot of just purely asymptomatic spread going around the Bay Area in California, without us knowing it,
That's
right?
yeah, that's kind of what I thought. I'm like, well, you see this being pretty devastating anywhere it goes, and it seemed very optimistic to think that we would be any
Right.
different.
I'm skeptical about that, and even if that happened, it's probably not going to be the case that it was here earlier. Now that sort of brings up, we're going to jump into testing, and I just want people to be aware that main testing that's going on is a PCR based testing. It's a gene, or an RNA based testing that actually measures uh, RNA particles. I think it's RNA particles from the virus itself, and that's how it identifies that it's there. it's very specific, meaning when it tests positive, we're 98, 99% positive that you've got COVID-19. It's not super sensitive because it depends on how many viral particles you have, how good the swab was, how good the swab was transferred, maybe other techniques about how well the test was run. And we know that it's somewhere between 60 and 80% sensitive. That means up to 40% of the time you could have it, but you're not testing positive for any number of different things that have gone wrong with the test, or the fact that maybe you don't have a high enough viral load to test positive. And so that's the main testing that's going on. Anybody that you're hearing that's testing positive for COVID-19, that's the testing that ISDH is doing, Eli Lilly, LabCorp, Quest, Mackle. Everybody's pretty much doing that testing. There is this evolving area of antibody testing. In antibody testing, part of the reason I want to make sure we talk about this is because I know there's an ambulance crew north of Tippecanoe County that had a Facebook post that said, "Hey, COVID-19 antibody testing, $50." Right, and we're doing it at such and such parking lot on such and such day or something like this. And someone brought it to my attention, and I said, "Oh, what is this? What's going on?" And one of my nurses at the health department had called the group, asked them about the tests, and otherwise, it is an antibody test for coronavirus. It is not specific for COVID-19. It does test for at least two different types of antibodies, something called IgM and IgG. IgM is an acute antibody, so you get coronavirus, whatever, through your nose, eyes, or whatever, and then your body develops the first antibody is IgM, and that's when you're sick, and then as you get better, your body has IgG antibody to COVID-19 that's developed. That's sort of your immune memory. And if there's an immunologist out there who says, "Oh, he's just doesn't know what he's talking about," it's good enough for government work, let's say. So, yeah. It's accurate enough, and so it tests IgM and IgG, and it's for coronavirus. It's not specific to COVID-19. So the challenge with this is that if you test it, then and you test positive for IgG or IgM, then did you have COVID-19? Did you have any number of coronavirus strains that are for the common cold?
Right.
And then is that going to make someone say they tested positive and they think they're immune to COVID-19 and they're going to
just go wild,
right, and forget all the guidance, and say, "Hey, I'm immune to it," and then get COVID-19 and potentially get really sick or spread it to other people. And so my feeling from Fountain Warren County Health Department, if you know of that testing going on in Fountain and Warren County, and today is April 11th, 10th, so we should date these things because this will change. At least if you know of this in the next 2 weeks, then call us and let me know, because I don't think you should get it. I don't think we should allow it in our county. And I know Tippecanoe County Health Department doesn't think that should be going on in their neck of the woods either. But I would actively try to prevent it from happening because I think it's giving misinformation. And I mean, it's a waste of money, and will either... I just don't see how it's useful now. Now, there may be antibody testing further down the road that can give us some idea that's better, to say, well, who should go back to work and who shouldn't go back to work, or how should we do this? It may get better, but right now for the general public, I don't think that we should use it unless there's detailed and specific information that's being given out with it so that people truly understand what the test means and doesn't mean.
They're very good points, and it sounds to me like if you do give somebody that information that you have it, and they're gonna be less worried about it. And those are the type of people that need to be not so concerned about themselves, but for others. And so, yeah, I wholeheartedly agree on that. And is there anything else that maybe you wanted to mention before we wrap this up? I know you're busy. We've been at it for about an hour, but
Um,
I went through the comments and it seemed like everybody was all the questions that were asked. I mean, man, you really nailed it. Dwayne from County Market said, "Sorry about that."
no, it's not about me, Dwayne, and I get it, and it's good for me to remind myself of that. And it was a good example. I went home, I took a walk, and it's fine. I was glad to see the signs, and I encourage you to keep up what you're doing, and I encourage everybody in the community to read the signs before you go in.
Yeah.
Make sure not everybody has to go in at the same time. And if you make a list, right? It's not social hour at the county market
Yeah.
or in the waiting room at McDonald's, right?
Yeah.
Um,
Do you think that the general public overall is doing a pretty good job with this, or do you think that it's being taken a little too loosely?
I think
I mean, I don't want to put you on the spot,
Yeah.
you know. I
Um,
don't,
I would say that because I've been practicing pretty good social distancing, so I don't
yeah.
have my finger on the pulse of the general public, but I would give Fountain and Warren County two thumbs up.
Yeah.
I think that we've been doing well. What concerns me is the risk. Is that it really takes all of us to do well. And I love these terms because there's these terms that like you hear on I don't know what kind of like Hollywood blockbusters, right? So every morning over at the hospital we have incident command, right? And then we have afternoon meetings that are like these EOC meetings, there's emergency operations center meetings, right? And so and and so we have these all the time. But at incident command the other morning, I said, I the modeling looks good. It looks like we've been successful so far. But what concerns me is that we have to be able to sustain this because it takes just one person who's cavalier says I'm going to go to work
Yeah.
sick, especially if you work in the nursing home,
Right.
or especially if you're around someone who works in the nursing home, then they go to the nursing home, 20 people die, the healthcare system is overwhelmed, and that all happens. It doesn't happen immediately. It happens in a period of 2 weeks, right?
And then all this for nothing.
Right. And so yeah, does that happen at the nursing home? Does that happen at the jail? Does that happen to, at Autumn Trace, right? Where we have, these vulnerable individuals. Does it happen with a church group who gets together this weekend and says, "Oh, you know what? We're past the peak now. Let's go ahead and have our Easter service,"
Mm-hmm.
right? And it can happen anywhere.
Right.
And I know that not just because I know the science. I know that because I know the contact tracing that's gone on for the individuals that have been infected in Fountain and Warren County, and I know how random it can be that, you know, this person's not left their home, their spouse hasn't left their home, but still somehow they got it, right?
Yeah.
And it was, confirmed, and it's not like they live in, the New York City of Fountain or Warren County. So my feeling is that this is still around. We fortunately we haven't had lots of cases identified here, but it's not like we're doing spread
Right.
testing, right? I
Yeah.
mean, we're Indiana has, for better or worse, and it depends on what you prioritize, but and what your resources are. But we still don't have lots of testing. I know that for the Fountain and Warren County area, and this is between all of the hospitals, all of, Williamsport Hospital, IU Health, St. Elizabeth, Indianapolis hospitals. I think we've had probably about 100 individuals who live in the Fountain and Warren County area who've been tested. There are a heck of a lot more than that who have inquired about testing,
I bet. Yeah.
but um, again, testing is of limited availability. So I still will, and I would say that I always want to get it in there. I still think that your go-to resource for Fountain and Warren County, unless you're critically ill, if you're having severe shortness of breath or you're really sick, then you call 911 or you go to the emergency room and you let them know that you have a fever and a cough, you're worried about COVID-19. You let them know before the ambulance crew comes, before you arrive at the hospital. Or if you drive there yourself, you find some way that they identify you immediately so you can get a mask on and be moved to an isolation room. If you don't got that going on and you're curious about COVID-19 or what you need to do in Fountain and Warren County, probably your best answer is fwhealth.org. And you may not like the answers, but the answers are still there, and they're specific to your community.
Well, I think it's all great information as always, and I'd say let's call this thing. It sounds like I think going through the comments, it looks like we've answered most of the questions that people have had, and people know how to get a hold of you and myself as well, and fwhealth.org seems like the place to find legit information, which is very difficult to find right now, and it sounds to me like this is going to be something that we're going to be battling out for a little bit yet. And, you know, as you are out and about in public, because I will say that Attica and Williamsport together, they seem busy to me. Like, I know that there's people off work and that type of thing, but boy, it seems like a busy time around here, and it seems busier than it normally is. And that was kind of surprising to me. So if that is you, just try to think of others as well and be courteous, and the social distancing thing seems to be like the top ranked priority right now.
Yes, definitely.
Yeah. And
And
so,
even after the governor's stay-at-home order expires, which I'll say I would be surprised if it expires on the 20th. So I think it may be extended at least another week or 2 weeks, but that's the governor's decision along with Dr. Box and Dr. Sullivan. But my feeling, even if that expires, I would say it doesn't mean we're out of this. It means that you've still got to follow these guidelines really closely and pay attention. And I will give a couple of other shout outs. If you're watching this and you want to grow a garden, take a look at our Facebook page, because there's the FW Victory Gardens team that's having garden kits that are available for pickup. I believe some tomorrow, and you have to go to Facebook, get the Google form link, and then fill it out, and then they will contact you shortly thereafter. And it's not complicated. You can keep the vegetables yourself, or you can donate them to someone else. Even if you don't have a green thumb, it's still a good thing to do. It's no cost. There's seeds for 20 to 30 plants. There's some starter mix and some education that'll happen with it, and it's a good community thing for us to do. There's also the GoFundMe page on the Fountain Warren County Health Department website, fwhealth.org, where we are collecting donations that would be then distributed within the community at a later date by the Board of Health. And so I know everybody can work together on this. I'm not saying, like, if you're off work, if you don't have income, don't donate to GoFundMe, but there are people who want to help somewhere somehow, and and I would say there are different things that we all have to give. So if your thing is making masks, that's great. If your thing is helping people grow a garden, that's great. if your thing is uh, keeping your grocery store running, do that, right?
Yeah.
But if you're looking for different ways to channel your energy, these are just some different thoughts out there.
And it is great to see the community come together and really people be so courteous. That's not that this community lacked that, but I think as a nation, it was becoming more and more scarce, and it's really cool to see people kind of come together and work towards a common goal. But yeah, I think we're good here, and as always, I appreciate you coming on.
Great. Well, and I would say, reach out to Brandon if you, as the community, have lots of questions. Then let him know. He'll compile those, and then maybe sometime when the weather's warmer, we'll meet again.
Knock out a round 4.
All right.
All right. Well, thank you again, and it's always a pleasure. And thank you all for watching. If you can, go ahead and share this podcast. I greatly appreciate it. It gets the word out to more and more people, and it not only helps the community, it helps me as well, and I'm very appreciative of that. So if you can, just hit the little share button right now. And as far as everyone tuning in, thank you as always. I'm trying to keep the podcast going, but it's a tough time right now, and trying to keep my distance with others, as long as I can and as long as I see fit, anyways. And so, yeah, I appreciate everyone, and I'll see y'all real soon.